We're here with Dr. John Norman from Associates in Orthopedics and Sports Medicine. Dr. Norman, welcome to the show.
Thank you for having me.
Good. Well, we've got an interesting topic tonight. We're going to talk a little bit about hand injuries. Is that a pretty common thing you see with football players? I would guess it is, right?
Right. Well, you know, we have the sports medicine clinic on Saturday mornings, and when we were thinking of subjects, decided the probably most common thing we see is hand injuries. And those can occur from a variety of things. Obviously, all sports, the hand's very important. With football particularly, we see hands that get crushed between helmets. We see fingers that get caught in face masks. We see players that fall on outstretched hands. And so it's a very common presenting complaint in our office as well as in the sports medicine clinic and on the sidelines on Friday nights.
Now, are there certain types of hands injuries that are more specific to certain positions? Do you ever see any correlation with that?
Well, I think in a football game, position-wise, probably not. Obviously the interior linemen, where there's more head banging going on, are at much more risk of sort of crush injuries, fractures. I guess defenders are more commonly, grabbing the face mask and have their fingers possibly turned in ways. And then I guess some of the skill positions, like a quarterback, would be more likely to have probably an overuse or a tendonitis type problem as opposed to an acute injury.
You know, I can remember seeing one of our quarterbacks at Tennessee one time, got his hand or the center, got his fingers up a little too, and the center hit when he snapped the ball. He actually I think broke a finger,
right.
One of the quarterback's fingers.
Yeah, I mean, I think you can really divide those injuries into several categories. In a situation like that, most likely that would be a joint injury to the point of dislocation. The most common thing we would see is just literally just a contusion or a deep bruise. Then we also see fractures. We can see dislocations, and then occasionally we'll see some tendon injuries. Specifically, there's one that's called a jersey finger that occurs when someone grasps a jersey and sort of has a sudden firing of one of their flexor tendons and actually avulses the tendon off the bone and makes the fingers where they can't flex.
Oh, wow. Now, talk about some of the treatment that you guys prescribe for the different type of hand injuries.
Okay. The first thing people want to know is whether their hand's broken or not, and so many times an X-ray is an important part of really ruling out a fracture. Most bruises of the hand are treated simply with rest, ice, compression, elevation initially, followed by a lot of times protective padding for the next week if the player's allowed to return to play. Fractures are most commonly treated in cast, and many football players actually do play with cast on, where you have them padded. Mm-hmm. And then sometimes fractures warrant surgery.
And it always amazed me, being a lineman, I would get, and never wore any hand pans, would always get hands smashed, and one of the best things that always seemed to work was just the old buddy taping.
Right.
It's amazing how much difference that makes when you just tape two fingers together, whichever,
right.
One injured one.
We very commonly, that's the only treatment for many fractures that are non-displaced. We'll just have the patients or the players tape two fingers together, and basically the finger that's not broken serves as a splint for the other finger. That helps to protect the finger from injury and also can help with mobility.
Now, how about some of the other ones? You talk some about the tendons. You see, you hear folks about having those type of injuries. Those can be pretty serious, right?
Right. Many tendon injuries do require surgery, and if those are missed or ignored, they can leave some long-lasting problems that makes the hand not as functional as it should be.
You could have problems with the finger not being able to bend in a certain direction, or
right.
Lots of issues like that, right?
Right.
Well, thank you for being with us tonight, and stay tuned. We'll be right back after this break.